My name's Victoria Lyle. I'm an advanced physiotherapy practitioner. I was employed here essentially to set up a service called the Virtual Fracture Clinic. Okay, we've got 40 patients this morning, so are you ready to start? I think advanced practitioners make a huge difference to a team. Because we're constant members of staff, we are able to do some of the legwork that is needed to drive change and service delivery and improvement. We understand the service that we work in because we're here. We care about it, we want to improve it. What we find as well as our skills have developed is that we've become an integral part of the team, and with the junior doctors we quite often are involved with the teaching. With medical students, they will often shadow us for a morning in fracture clinic or sit in the virtual fracture clinic. But we can also have quite educated, challenging conversations with our consultant colleagues. Setting up the virtual fracture clinic was really a solution to the problem that's countrywide, that fracture clinics are really busy, quite often stressful, unpleasant environments for both patients and staff. And really it's unsustainable as the population grows.
The way that Vicky Lyle has set up Virtual Fracture Clinic now is that all of those patients are reviewed without them needing to come to hospital, thus saving them time and money. It also saves time for the orthopaedic team. They're concentrating on their specialist area of care so that they can save their expert advice for those patients that are most relevant to their specialty.
In December of last year, I managed to break my wrist falling from a chair while trying to retrieve some vinyl records. The x-ray happened quickly, so I knew reasonably quickly that I had broken my wrist. And then I was very fortunate in being able to talk to the advanced practitioner, Vicky, about the options of treatment. My wrist was manipulated back into place, in effect. What it meant was that I could get my treatment there and then, and that obviously I'd have follow-up physio once the bone had reset, so my treatment plan was quicker than I think it would have been in the normal course of treatment.
These patients now get same-day MR, which is brilliant. They also get a report overnight, and then I telephone the patient the next day. They don't have to come back for their results if they're negative. It's a great job. I think that it provides lots of rewards. You work within great teams. We're very involved from the very beginning of our physio training of imparting knowledge to the patient, encouraging self-care and being holistic in the way that we look at a patient. So the variety of what it does on a different stage, taking me out of the hospital and onto a more kind of national and regional level has been really exciting.